Good morning, ladies and gentlemen. I'm very honored and thrilled to be with you here today, attending very important event, today's event, which is the fourth International Conference on Biological and Health Sciences at Jihan University in Erbil, Kurdistan. First, I would like to thank the organizers of this conference for their efforts in bringing together an elite gathering in order to boost our scientific knowledge and to enhance our research works in the field of biological and health sciences. Secondly, I would like to apologize for not being able to make it to Erbil and to be physically with you due to technical issues. But anyway, it's my pleasure to present the results of the study entitled The Efficacy of Probiotic Supplementation on glucose level, or blood glucose level, lipid profile, inflammation biomarkers, and body weight changes among type 2 diabetes patients. As we know, diabetes is a chronic and long-lasting health condition that affects how body uses food and turns food into energy. When blood sugar goes up, it signals pancreas to release insulin. With type 2 diabetes, body doesn't use insulin well and can't keep blood sugar at normal levels. About 90 to 95% of people with diabetes have type 2. This type of diabetes develops over many years, and it's usually diagnosed in adults. The World Health Organization in 2002 defined probiotics as living organisms in food and dietary supplements that upon ingestion can improve the health status of the host beyond their inherent basic nutritional content. The gut microbiota plays a role in development and progression of type 1 and type 2 diabetes and their complications. Gut dysbiosis contributes to the pathogenesis of diabetes mellitus. Any disturbances in intestinal biology contribute to the development of diabetes mellitus. Many studies have shown that the gut microbiome plays a role in the etiology and progression of type 1 and type 2 diabetes. The gut microbiota have been shown to influence the efficacy of different anti-diabetic medications. Intake of gut beneficial bacteria like prebiotics, probiotics, and symbiotics can improve the glucose level as well as the metabolic profile associated with diabetes mellitus. The objective of this study was to find out the efficacy of probiotic supplementation on glycemic control, inflammation biomarker, lipid profile, and body weight changes among type 2 diabetes patients. In this study, a total of 65 participants, 35 females and 30 males were recruited for this study. Participants were diagnosed with type 2 diabetes and were recruited among patients who visited endocrine clinic. The patient included were aged from 33 years to 56 years. The participants were divided into two groups, the trial group and the control group. The trial group consisted of 36 patients, 16 females and 20 males, whereas the placebo group consisted of 28 patients, 13 females and 15 males. The current study was a randomized double-blind placebo-controlled trial The enrollment of subjects were performed by study researchers. Both participants and researchers were blinded, and supplements contents were kept confidential until all subjects had completed the study. Only one of the staff of the development committee was aware whether supplements was probiotics filled or placebo. The present study lasted for 12 weeks. During this period, the trial group received daily one capsule which contained 14 different species of probiotics from a company called ProNutrition Advanced Probiotics. Each capsule contained 2 billion CFU. The bacteria in this capsule were mostly from Lactobacillus, Bacillus, Streptococcus, and Bifidobacterium. The control group or placebo group received also daily capsule. One capsule contained roasted ground chickpea. In this study, we checked the fasting blood glucose, serum turum necrosis factor alpha, TNF-alpha, and C-reactive protein, and also we looked at lipid profile like total cholesterol, HDL, LDL cholesterol, and triglycerides. Also, we have taken some anthropometric measurements such as weight, height, waist circumference, and BMI. We recorded that at the beginning and the end of the study. In order to avoid any effect of food on both groups, participants in both groups had isocaloric diets. They have almost the same amount of calorie, like 17 to 1800 kilocalorie. Result of the study has shown that supplementation of multi-species probiotics has significantly decreased CRP and TNF-alpha in the trial group. CRP level was 2.11 at the beginning and decreased to 1.68, whereas in the control group, CRP level was 2.51 and decreased to 2.31 at the beginning and at the end of the study respectively. TNF-alpha also decreased in the trial group from 6.8 to 5.4, whereas the decrease was not significant in the control group. It was 7.6 and became 7.8 at the beginning and at the end of the study of the control group respectively. The results of this study showed that probiotics supplementation of multi-species probiotics to type 2 diabetics significantly reduced their fasting plasma glucose. In the trial group, fasting plasma glucose at the beginning of this study was 154.4 and was dropped to 131.1, and the difference was statistically significant. Whereas the drop in the control group was not significant, 147.7 versus 145.7. The data presented in this study has also showed that supplementation of probiotics to type 2 diabetics reduced their total cholesterol level. Total cholesterol level was 219 at the beginning of the study and decreased to 184. And the difference was statistically significant. Total cholesterol level were dropped from 150 to 128, whereas in the control group, triglycerides level increased from 139 to 141. Supplementation also of probiotics decreased significantly LDL level and cholesterol HDL ratio, and also improved HDL level. The control group did not have any improvement in these indicators. Multi-species probiotic supplementation had also a positive effect on body weight. BMI in the trial group decreased from 30.4 to 27.6, and the difference was significant. In the control group, BMI increased slightly from 33.4 to 33.8. In this study, we tried also to find out if there was any adverse effect of using probiotics on gastrointestinal health, including bloating, constipation, GERD, or allergies on participants in both groups. We had only more cases of GERD and allergies in the trial group compared to control group. We cannot attribute the increase in the number of cases to probiotics. Therefore, we need further studies to confirm that. As a conclusion, supplementation with probiotics significantly reduced the total cholesterol, LDL cholesterol, and triglycerides, and increased HDL cholesterol. Some benefits were observed on glycemic control, inflammation, and anthropometric measurements. The present study suggests that probiotic supplementation should be indicated as adjunctive treatment for glycemic control and dyslipidemias. Further studies should be developed to clarify long-term effects as well as the influence of probiotics in combination with drug therapy. Finally, I would like to conclude my presentation to extend my gratitude to Jihan University in Erbil, Kurdistan, for the invitation and to participate in this conference. And I would like to wish everyone in the conference a successful, safe, and fruitful conference. And thank you very much.